Hi, everyone. Welcome to today's webinar titled How Can We Transform Lung Cancer Policy into Action in the Asia Pacific? I am Dr. Herbert Leung. I'm a clinical associate professor as well as the deputy medical director of the Phase 1 Clinical Trial Center at the Chinese University of Hong Kong. And it's my pleasure to be able to welcome you to this webinar, which is co-hosted by the Asia Pacific Policy Review and Engagement for Lung Cancer, also known as ASPIRE, together with the Asia Pacific Coalition Against Lung Cancer, or APCLC, as well as the Lung Cancer Policy Network. Next slide, please. Before we begin, and we only have 1 hour and we have a very packed agenda, what I would like to do is just give you some housekeeping notes first. And certainly, I think to begin with, it's important for me to remind you that this webinar is being recorded and will be available in the coming weeks on our websites. This webinar will include, of course, a panel discussion at the end, and we very much welcome your questions. And during this time, please use the Q&A box to ask any of your questions, and we'll try to get them discussed during the discussion. The aim of today's webinar really is to showcase some of the policy initiatives that's been ongoing in the Asia Pacific region, as well as more globally, and to discuss how we can turn policy into action within the region. And certainly throughout today's event, hopefully we'll be able to raise the awareness of the ongoing lung cancer policies in our region, and hopefully be able to equip you as participants with actionable strategies that can be integrated into regional policy initiatives in actually making sure that we could propel our lung cancer advocacy efforts. And we'll also have some showcases of some of the real world examples where there have been very successful engagements between the different stakeholders in a lung cancer policy in our region. And hopefully we'll be able to inspire you as well as other participants to be able to replicate some of these efforts and adapt it to your needs. Next slide, please. And I think just to set the stage and just to remind everyone that in actual fact, lung cancer in the Asia Pacific region is somewhat different from the West. As you can see in the slide here on the left-hand side, we generally see lung cancer in a slightly younger age group than what we see in the Caucasian population. There's an increased number of non-smoking individuals with lung cancer in our region, especially in the female population. We know that our lung cancer is associated with some of the risk factors which are more unique in our region, including, say, air pollution or the presence of organic matter. The incidence of lung cancer is in East Asia is also increasing. And aside from the air pollution and organic matter, there have been also reports of risks due to occupational exposure, issues with, say, the way we cook and the way we combust some of our fuels, not to mention family history being something that's very strong and prevalent in our region. On the right-hand side also shows you the oncogenic driver gene alterations that we see in our lung adenocarcinoma, which is very different from the Western population. We know that, for example, EGFR is a very common alteration in our region, as opposed to the Caucasian population. And this has very clear significance in terms of the reason why we wanted to detect this early, because there is a clear, well-established guidelines as well as treatment paradigms now to really give adjuvant treatment for these patients, and to be able to identify these individuals early, to be able to provide them with a very effective drug, for example, that can actually reduce the risk of recurrence. Therefore, it gives us a particular reason why we should be working on early detection for lung cancer. Next slide, please. And whilst we have been concentrating on issues of, say, lung cancer screening, I just want to highlight some of the work that we've done in the last 2 years and really, again, set the stage for today's discussion. So about 2 years ago, or should I say last year, actually, last October or so, in conjunction with the APCLC meeting that was held in Hong Kong, the Lung Cancer Policy Network, together with the Asia Pacific Coalition Against Lung Cancer, we actually held a workshop in the pre-meeting seminar where we're able to bring together, again, different stakeholders from the region to really set up a list of, say, recommendations for us to develop and to enhance lung cancer policy. And building on that foundation, as well as webinars that we've had throughout the period, in this year's ACLC, again, that was just recently held in Ho Chi Minh City in Vietnam. Now, both the APCLC, the Lung Cancer Policy Network, and now together with Aspire for Lung Cancer, we've held a second workshop titled Implementing an Effective Screening Program for Lung Cancer, where again, we've had various stakeholders from around the region to try to give more practical support for effective screening rollout programs within the region. And I think our prior events have really tried to emphasize on the importance of tailoring what we see as a global policy in terms of, say, lung cancer screening, and then tailoring it for our local contexts, and really hopefully be able to have that expertise in terms of the people who are there to leverage on local insights and innovations, and therefore be able to inform subsequent international recommendations. Next slide, please. And another highlight of what we've done in the last year was, in actual fact, the establishment of the Asia Pacific Lung Cancer Policy Consensus. We'll be going onto a deeper dive of that particular document during today's webinar, but really just to showcase the fact that, during this year, we've established this consensus document, and we were able to present this consensus document at the recent Asia Pacific Economic Cooperation, or APEC meeting that was held in Seoul, Korea, in September earlier this year. Next slide. And to introduce the Asia Pacific Lung Cancer Policy Consensus, it's my pleasure to be able to invite both Ms. Judy Lee as well as Mr. William Brown, who is the consortium manager as well as the consortium director for Aspire for Lung Cancer. And they will be taking us through this document and hopefully be able to paint a clear picture to all of you on our particular consensus document and how this can potentially be useful for us to really have a basis for further discussions with policymakers. So over to you, Will, as well as Judy.
Thank you very much, Herbert, and thanks to everyone joining us today. Great pleasure to be here and discussing this really important topic. As we have been throughout the couple of years that we've been in existence, it's really the key question to solve is, how do we transform great ideas, great energy that is in the region into actual policy change? So today we're going to take you through a couple of our key initiatives that have started to do exactly that, starting at the regional level, and then now we're into the next phase, which is getting down to the individual health system level, and advocating and implementing change there. So I'll be talking you through, first of all, a little bit about Aspire for those that we are new to, and then also about our regional consensus work from earlier this year. And then I'll hand over to Judy, who's going to talk about how we've transformed that into action in one health system, which is Thailand, which is the first of our health system level initiatives. So Aspire is a multilateral effort. We convene a group of stakeholders from across the healthcare ecosystem, from physicians and academic key opinion leaders to patients and patient advocates and groups, as well as industry and also the other nonprofits in the lung cancer space. And our aim is really to help to improve lung cancer outcomes in the region, but doing that through policy engagement. Next. So we work really fully across the region. You can see flags across the bottom for all of the health systems that we've had involvement with so far. It's not every single one in the region, but we do aim to be as broad as we can to make sure that we're really addressing the needs of the whole region. But of course, we have to prioritize and look at target initiatives. So we mix a little bit which health systems we're looking at, depending on the activity and the needs of each of the health systems. But as I said, really, it's about how do we convene at a regional level, and then how do we drive that through to the individual health systems with this multilateral approach. Now, in the next slide and section, I'm going to talk through one of our regional initiatives, which is the Lung Cancer Policy Consensus. Now, this initiative came from, or was formed a part of a global lung cancer consensus exercise that has been convened, and it has also been put forward at the World Health Assembly and various global forums. But when we started talking about this from an Asia-Pacific perspective, we realized that while the global consensus statement has a lot of very important initiatives, very important calls to action, we actually needed something a little bit more specific in the APAC region. As Herbert said at the beginning, we have a lot of differences with other parts of the world in the region, and it was really important to make sure that those were captured. So what we set out to build was we have a global consensus at the top level, which calls out some of the key pillars. And then we wanted to also look at the level below that, a layer below that, for what are the key imperatives for the Asia region. So to do that, you can see the approach that we took here. We convened more than 40 experts across 14 of the health systems in the region, across all the different stakeholder types, to work on this consensus statement. We had 6 coordinated sessions, starting from pre-workshop alignments, surveys, through to live consensus building discussions and final validation. And we ensured that the patient voice was integrated throughout. So we had a dedicated session working through all of these statements and hearing the voices of patients, caregivers, and patient groups to ensure that the priorities, the calls to action that we were making, being rooted in what patients need as well. And this sort of culminated in an official launch just a few months ago, which was then the sort of official unveiling and launch of this consensus document. So this was the process we followed. I'll talk you through a little bit in terms of what was there in the consensus and next, and how we are driving that through to local action. So, as I mentioned earlier, there are 5 pillars or principles of the APAC consensus, and this is what we all united around, aligned on across all of those different stakeholders from around the region. So these are focused on improving and expanding prevention, focusing on early detection, ensuring equitable access to diagnostics and to treatment, building partnerships and promoting investment in lung cancer, and last but not least, combating stigma and improving the patient experience. So under each of these pillars, we had a series of detailed statements that call out what is needed to change and be improved across the region. And this was then able to sort of filter back up to the global consensus, which also contains a focus on these 5 principles as well. I think the really important point here is, no one of these principles can be looked at alone. It has to be a collective effort across the care continuum for patients to drive meaningful change. Doesn't mean you have to do all at once, but it does mean that they all need to be considered and taken forward. On the next slide, just have a snapshot of the document itself. You can find this on our website under the publications tabs as aspirelungcancer.com, and you can find that full document there. But we also just have a couple of key takeaways on the next slide, which I can talk through quickly. Maybe I think it's maybe a hidden slide. Can go back to this one. So just to talk through what this document has, is the statements themselves. So amongst those 5 pillars, what are the detailed asks and needs across the region? And it also has, the ideas, where this has come from, what supports these calls to action, so that policymakers across the region can see this and see where are the key needs. After the consensus was launched, we've then, as I said, we've embarked on a series of these health system level roundtables, first of which was in Thailand. I'd like to invite the consortium manager, Judy, to take us through what we have been doing so far in Thailand.
Thanks, Will, and thank you to Herbert. So I will take you guys through our health system focus roundtables and also some of the next steps and objectives that have been happening after the roundtable itself. Next slide, please. So in this year, we have hosted 2 editions of the Thailand Lung Cancer Policy Forum in Bangkok, and we managed to convene some key stakeholders to align on the strategies for lung cancer. So the roundtables were convened with senior policymakers, academics, clinicians, as well as civil societies, and featuring also strong government participation, which includes Dr. Danai. He's the Deputy Director of National Cancer Institute, and also Dr. Somchai, Director of National Cancer Institute as well. And also have representatives from NHSO, CSMBS, and also SSS Department of Disease Control, and HITAC, which is the sort of the local service delivery experts as well, in terms of the policymaker side. So the first edition was held in April of this year, and the focus was on early detection and screening. So during the roundtable itself, we reviewed Thailand's lung cancer landscape and also the gaps that exist currently, as well as exploring the phased low-dose CT rollouts and community-based screening and addressing barriers. So certain things like TB false positives, inequity issues, as well as lack of solid guidelines for certain services. And in the outcome of the discussion of the roundtable itself, we formed an agreement to have a national screening workshop to inform policy. So the experts and also the policymakers that were in attendance, they came to a consensus, and also they came to an agreement to say that they will be working towards this together. And then in the second edition, which was held in early July of this year, we held the second roundtable, which is focusing on diagnostics, treatment access, and financing. So in that roundtable, we examined the equitable access to biomarker testing and targeted therapies. We discussed the coverage gaps between the different government provisions and plans, and which was widely different between all of the coverage. And then we proposed MEAs and also a cancer drug fund and reimbursement reforms. As a result of the discussion, the group came to a consensus to expand reimbursement and pilot innovative funding models. So from these dialogues, a set of actionable recommendations emerged to guide policymakers in advancing near-term progress to improve lung cancer patient outcome. Next slide, please. And drawing from the insights of both the sessions, Aspire developed a policy brief to translate recommendations into concrete policy and programmatic actions for national implementation. So this policy brief was created with 3 priority calls to action, which were identified through our discussions and the roundtable, and it represents high impact steps that Thailand can take, and that's it's as a recommendation for the government to take in the near term to improve lung cancer outcomes in the and equity. So in going down these topics from the patient journey angle, the first one we look at is strengthening lung cancer screening. So scaling up low-dose CT screening pilots in a national program and broadening eligibility to high-risk groups, which would include, for example, smokers with more than 20 pack years, those with family history, and non-smokers with risk factors. And then also testing related to mandating EGFR, ALK, and PDL1 testing for reimbursement eligibility, and enhancing the testing effectiveness with small panel multi-gene NGS, either upfront or sequentially for negatives, and reimbursing biomarker testing in parallel with therapy listing to unlock precision medicine benefits. Because in Thailand, currently it is still some of the drugs that are being listed some of the tests that is associated with certain therapies are still not being reimbursed at this moment. And then also expanding access to innovative treatments, extend reimbursement under SSS and UCS for third-gen EGFR, TKIs, as well as ALK inhibitors, and immunotherapy for high PDL1, and to ensure equitable access across all public schemes. Next slide, please. And so building on the dialogues as well as follow-up actions with the Thailand government to amplify and sustain policy momentum for further strengthening, we have worked with the Thailand government to further strengthen the collaboration among stakeholders. So in August 2025, during the APEC Health Working Group that Dr. Lung and Dr. Kim were at, there were in the senior official meeting in Incheon, Dr. Danai from National Cancer Institute of Thailand, who participated in Roundtable 2, delivered a presentation highlight with key advancements in lung cancer policy, with a particular focus on core ASPIRE initiatives, which were discussed during the roundtable. And then subsequently in September, a targeted policy brief, which I just showed and presented just now, it was developed based on the discussion and consensus statements from the two roundtables, with the 3 key recommendations that we push forward. And then in October, the policy brief was translated in Thai and then delivered to our local partners and Thai representatives of APCLC, Dr. Tanya Nan and Dr. Nairat, to the director of NHSO to further discuss and advance the 3 key call to actions. And then from September to the present, the ASPIRE team continues to collaborate with Dr. Sakang, who is the Deputy Director General of the Department of Medical Services, to strengthen engagement and commitment towards the joint policy efforts. So Thailand Department of Medical Services of MOPH have also confirmed to co-host our ASPIRE flagship summit in Q1 2026, which is happening early next year, quite soon. So we're also looking forward to continued collaboration with the Thailand government as well as the policymakers. Next slide, please. So I think that's the end of the ASPIRE sharing. So passing the time back to Herbert. Thank you very much, everyone.
Thanks, Judy, and thanks, Will, for walking us through the Asia-Pacific Lung Cancer Policy Consensus, as well as some of the work that's been done, especially in Thailand, showcasing how there's been work in a local setting and trying to really use that policy consensus document in real life and real time, hopefully being able to shape the policy landscape for Thailand. And I believe we're trying to replicate the same in other jurisdictions as well. So we look forward to hearing more about these efforts in future webinars. And we'll reserve any of the questions to the end. And it's my pleasure to invite Helena Wilcox, who's currently the network lead of the Lung Cancer Policy Network, who will be now speaking to us on global policy developments in lung cancer care. So, Helena?
Thank you very much, Herbert, and all of the other speakers and the participants. Lovely to be part of today's webinar. As Herbert said, my name's Helena. I am the network lead for the Lung Cancer Policy Network based in the UK. So I'm just going to introduce a little bit about our work and then situate some of these conversations on Asia Pacific, specifically within a broader global context. And hopefully that's also a perspective I can bring to the panel discussion a bit later as well. So just to briefly introduce the network. So the Lung Cancer Policy Network is a global multidisciplinary alliance, ultimately aiming to make improving survival from lung cancer a policy priority. And we do this in several ways. So advancing the political prioritization of lung cancer through policy engagement activities as a network, and then also working with our members at a regional and local level. We also really want to focus on implementation, so not just generating policy recommendations, but accompanying those policy recommendations on earlier detection, screening, and improved and optimized care for lung cancer, really situating those recommendations with implementation tools and approaches and sharing best practices from around the world. And then also finally developing advocacy resources, so working as a network and with and in partnership with all of our members to ensure that best practices are shared and that we can build consensus to inform optimal practice. So very kind of complementary to the work that's been described in the consensus documents, and we work very closely with Aspire and APCLC to have a sort of bi-directional feedback loop on the kind of policy landscape at the global, regional and national levels. So just to give you a kind of visual of where the network sits. So the team leading the secretariat for the network is based in the UK, but our membership is now just over 110 from across 40 locations around the world. So you can see many members in the panel discussion today are participating in the network. And among those networks, among the network is also a broad range of expertise. So we count patient organisations and advocates, clinicians, and leading lung cancer researchers and also industry partners, all coming together to feed into that multidisciplinary perspective on lung cancer. And again, I sort of wanted to just situate today's discussions in the sort of global landscape of policy shifts. So I think this year, 2025, has been and continues to be a very significant year for lung cancer in policy and recognition of lung cancer and the number of people, the high mortality from lung cancer, and also the economic costs of lung cancer around the world. And I think there's been a groundswell of attention on lung cancer this year, but I also want to acknowledge that really reflects the years and decades of advocacy, research, and engagement with policymakers that many people, including those part of the panel discussion today, have been involved in for years. And it's really incredible to see the culmination of that in so much attention on lung cancer in global, regional, and local policymaking, particularly this year. But again, it's not just in 2025 that these efforts have been made. So I wanted to touch on a few of those things. So firstly, earlier this year, we saw the adoption of a resolution on integrated lung health at this year's World Health Assembly. It touches on a range of communicable and non-communicable conditions, but includes specific mention of lung cancer. And it also really critically emphasizes the shared risk factors and some of the shared opportunities to address lung diseases, including lung cancer. So I think this sort of global level document being discussed in the World Health Assembly and the implementation and next steps of which will be led by the WHO is really a sort of lever on which to draw kind of further regional and local policy efforts to kind of open a door to policy engagement, particularly in locations where that has been sort of not a strong focus to date. And coupled with the resolution is the ongoing activity around the International Agency for Research on Cancer's Handbook of Cancer Prevention, which is focused on lung cancer screening, which is currently under development. again, a really important document that will provide a very, very robust evidence synthesis of screening approaches for lung cancer. So I think that that's anticipated to be published either next year or the year after. But again, that sort of global evidence synthesis and real cornerstone of underpinning future screening activity, particularly where screening isn't currently underway. I won't touch too much on the consensus statements, given Judy and Will have led those and therefore have already shared a lot of detail around those. But again, just to touch on that sort of bidirectional feedback on the sort of global to regional to local policy, and that all of these initiatives, that feedback loop is really important in terms of shared learning, building consensus, and kind of bringing greater policy attention to lung cancer in different locations around the world. And indeed, with all of the policy activities that we do at the Lung Cancer Policy Network, all of our members are feeding in their best practices, the research that they're conducting to feed up into those global level policy recommendations. And then we're working with groups like APCLC and Aspire to feed that back in the workshops that Herbert mentioned during his introduction. Just to touch on the last couple of points. So also just wanted to recognise the more kind of local progress that's taking place, particularly on lung cancer screening. We continue to see greater commitments to screening, adapted guidelines in Japan to include low-dose CT screening alongside its existing chest X-ray programme. And then finally, the recent announcement of the ISLC Lancet Commission on Lung Cancer, which I understand will be commencing very soon. Again, kind of bringing greater attention and really kind of bridging between the research and evidence and leveraging that to build consensus and engage with policymakers. So just to conclude, that lots of the work that we focused on at the Lung Cancer Policy Network, whilst we focus on the kind of whole spectrum of lung cancer care, we have drawn specific attention to screening for lung cancer, noting that earlier detection, as I'm sure we'll discuss in the panel, is a really critical opportunity to improve outcomes and survival for lung cancer. So I just wanted to reflect on the progress that is being made, but also note that there's still a way to go, that the strength of evidence, particularly for low-dose CT screening for those at high risk of lung cancer, is not currently matched by policy commitments, in particular where there are high rates of lung cancer. And this represents a significant opportunity for us to kind of move the dial towards detecting lung cancer earlier, and particularly at the Lung Cancer Policy Network is one of our continued focus areas. In terms of the resources and some of the data points that I've highlighted, all of this information is captured via our website. So all of the resources and implementation tools that the network has on screening, earlier detection and optimal care are available freely on our website. So I'd very much encourage you to connect with us and access those. And if you have any questions about them, please do get in touch. But I think that's me passing back to Herbert. So thank you very much, everyone, and Herbert in particular.
Thanks, Helena, for walking us through, again, the commitments and the things that LCPN have been really trying to advocate for and has really been leading our, the global community in terms of, say, lung cancer policy as well as screening, and certainly the exciting times that we have in the last year or so in terms of some of the projects, initiatives, and advancements in lung cancer policy globally. So I think, again, these are very exciting times. And certainly for today, we are also very delighted to be able to invite other panelists to join as well. This includes Professor Yong-Wook Kim from Seoul National University Bandang Hospital. He's a pulmonologist with a lot of interest in, of course, the clinical aspects of lung cancer, but as well as the policies. And he's a good colleague of mine within the APCLC. We're also very delighted to be able to invite Mr. Francis Goh, who is actually a patient advocate from Singapore and currently is part of the Lung Cancer Education and Advocacy for Patients Group, also known as LEAP. And also, a real delight to be able to invite my friend and colleague, Dr. Savanti Lemay, who is actually from Mumbai, India. She is actually a very strong advocate for both precision oncology as well as lung cancer policy, and very much experienced in, again, trying to push the needle in terms of trying to get new policies out as well as new technologies to really try to advance the care for our patients as well as for our communities. And certainly, I think for today, you've already heard that the Asia Pacific region is a distinct and different place in terms of our molecular epidemiology, in terms of the lung cancer that we see, and not to mention, of course, the fact that the social economic status of the various countries within the Asia Pacific region may be somewhat and is somewhat different from, say, the Western population. So I think in terms of these specific 5 principles that Will has already highlighted during his talk of essentially where we're trying to make sure that we have policy advancements is somewhat different in terms of how we as a community in the Asia Pacific region should be addressing all this. So I'm very happy to be able to moderate this discussion amongst our panel. And certainly, whilst the panel is reflecting their own ideas, we of course also welcome all of you as participants to type in your questions in the Q&A. And certainly, hopefully, our panelists will be able to address some of the questions that you might have. So maybe whilst we're waiting for the questions to come in, I would just start the ball rolling. And certainly, again, as you can see, there are these particular 5 pillars that we want to specifically address. And I think we talked about lung cancer screening for quite a bit previously. And what we really want to talk about today possibly are some of the other aspects in terms of lung cancer care continuum. So I think early detection is definitely something which is very important for us to be able to, again, diagnose patients early. We know that by diagnosing them early at an earlier stage, the prognosis is certainly better for patients to be able to receive treatment early. Not to mention, of course, the costs associated with treatment at an early stage would certainly be much more cost effective than identifying and treating somebody at a later stage. At the same time, though, again, our social economic situation in the Asia Pacific region is very diverse. Maybe I'll just ask Savanti first, because you are really a lead in both lung cancer care as well as precision oncology and diagnosis. Can you share some of your insights on how this is important, and also maybe at the same time give us a idea of where, say, India is in terms of, say, policies of, say, early detection?
Thank you, Herbert, and thank you, Lung Cancer Policy Network, Aspire, and APCLC all for supporting me and for having me here in this webinar. Congratulations. Herbert, coming to your question, I think there are 3 or 4 points that I very quickly wish to address here. Beginning with lung cancer awareness. Actually, in Asia Pacific region, we know how a significant percentage of our people are getting lung cancer, even though they are non-smokers. So the mantra, anyone who has a lung can get lung cancer, is very critical in spreading the awareness in our region. I think it's not just the high-risk identification, but it also means someone who has symptoms, could not just have TB. They may definitely have lung cancer. And this thought needs to percolate through the entire country. And people, even in tier 2, tier 3 cities, need to start being oriented to the lung cancer facts, so that even the doctors who are thinking only tuberculosis could then start thinking lung cancer and test for that early, and not with the stories of patient being in circulation for 6 months and then being diagnosed in advanced stage. So the awareness and orientation is the first point. The second point, I feel in India, in this resource limited nation, there should be efforts for high risk identification. So I personally, as well as in collaboration with many colleagues across the nation, we are putting forward efforts in high risk identification. At least that becomes very, very important, because that's the first pass that you can salvage, that you can help. Third is screening. India as a country does not screen, and we need to step up to own screening. Yes, it's the job of the government, but in India, 80% of healthcare still comes from out of pocket, from the patient, those who can pay. Even then, even they are not getting screened. So I say we need to come out in a revolutionary way. We need to get public private partnerships to come in and help. We need insurers to come up and put up certain criterias for screening, wherein if the person gets screened, the policy may come in for lesser cost next year. A lot of innovative methods to come in to support screening. And as a nation, raising awareness enough for the masses to own screening. So own prevention, own screening. And lastly, I think facilitating screening. So the hub and spoke model for screening, where if you have a QR code and you scan that, you are then directed towards a responsible party who will then direct in that particular area, in that particular state. India is a large nation. Local screening centers should be enlisted in a command center model where the patient and the families could be directed whether they are low risk, high risk, intermediate risk, and where should they go for their screening. I think these are very, very basic methods that we are already collaborating with multiple partners in the city, across the nation, to try and propagate such practices, wherein, of course, interfacing with the government and bringing about a policy development in this area would be most critical. And several colleagues, including Dr. Abhishek from New Delhi, we are working together in several ways. I intend to collaborate with him more and come together with certain recommendations and suggestions for the government also for policy development. So I think we need to collaborate on different levels, several grounds, but right from the grassroots level of awareness and orientation to owning prevention and screening, to high risk identification, and then to facilitate the screening. Then only it will come a full circle.
Thanks,
Thank you.
Avanti. That's really good. And I think, knowing the current situation in India, as well as, again, given the fact that I think you're in the early phase of screening, but at the same time, there's such a big need. And how do we make sure that we're able to do this in a very cost-effective manner, to be able to, of course, have a high penetration throughout the entire country as well, where there's so much diversity in terms of healthcare access. And I think, there's a lot of experience from other countries, but what would be right for India has to be thought of and planned for the Indian population because it's so different. And so I think maybe in order to have this discussion further, it would be great to also hear from Yoon Wook, who obviously is from Korea. He's very well experienced in terms of lung cancer policy. And my understanding for our previous conversations is in Korea, there's already an established cancer screening program, and lung cancer screening itself has been plugged into that program. Maybe, Yoon Wook, can you just walk us through the situation in Korea and what are some of the early results on whether or not it's been helpful?
Thank you, Herbert. And first of all, thank you for having me for this engaging discussion, and really very encouraging to see what all our collaborative efforts have been done. And actually, what I completely agree with Swanti, and what we want to say and want to discuss are all like completely addressed in those kind of policy statements on all the publication, and those are good, all very nice reference to refer to. So in Korea, we do have like maybe an early adaptation of a cancer screening program, but I think every like country has its own problems to address and learn from other policies as well, because in many countries, most of all countries, the lung cancer is the number one killer of cancer-related diseases. So many for policymakers and healthcare systems, they must prioritize in some way to reduce lung cancer. And I think the most important way and the most effectiveness to prove is to encourage adoption of the national screening program with with efforts putting on to reduce the risk and actually more stratify the risk for its own population to set its own screening program that would more fit to its own policy. And what I see as a very important question from Kushik Pratispan, and I'm aware that many countries are thinking of chest X-ray as an alternative to low-dose CT, where low-dose CT cannot be available for the public or the national level. And I think those kind of adaptive tools can be a very nice adjunctive or alternative, because even we do not have the firm evidence that might be adapted by the US, but we do have data that chest X-rays with AI can act much more better than the chest X-rays that were like prevalent 30 or 40 years ago, and better with the integration of AI and the recent technologies. So what we must do is raise public awareness and and acknowledge what we have in our hands, the options and the budget and the cost, and integrate them into our own policy. And that way, more discussions with other systems and learning from other programs is very, very important and useful.
Yeah, thanks, Young-wook. I also completely agree. I think there is no one magic formula that would necessarily work for every single country. And we also have to look at what resources we have and what's already on the ground. So certainly chest X-ray with AI component, for example, may be a better method in some countries where, say, there isn't a CT scanner that's readily available. So we should find our own path, and hopefully, again, we'll be able to shape policy to be able to encourage all this. I do want to shift gears a little though, because, I think throughout the last year or so or 2 years, we've talked a lot about screening, but I think, certainly there are other aspects to the lung cancer continuum that I think is worth addressing. We're very delighted to be able to have Mr. Francis Goh here, who's a patient advocate and also a lung cancer survivor himself. So I think one of the biggest challenges with lung cancer, at least in our region, is there's always this stigma of it being a smoker's disease, or maybe honestly something that you've done in your health that led to this particular situation. What is the current situation right now, say, Francis, in Singapore, for example? From your experience, do you feel that stigma is still an issue? And if so, what is being done to try to combat this?
Well, first of all, thank you very much for having me. I'm no medical expert, but it's through a lived experience that I can share. Frankly speaking, I'm very encouraged by all these organizations like Aspire and all of you here, putting up policies, recommendations to policy for implementation. Now, what I hear from our friend from India, even sometimes with policies implemented, you have people refraining from coming up for the early screenings, for example. Particularly in Singapore, I would say, because we have a very good health system. And I was just at a medical exhibition yesterday. And the thing that I gathered when I was standing there, encouraging people to go for early screening, the thing is that the thing came back to me was that, I'm very well looked after already. If I've got a problem, they will come and tell me I've got a problem. Otherwise, I don't need to be there. Now, basically, it is a mindset. Firstly, cancer is a taboo word. It has remained as such for a long time. Whether you are a smoker or a non-smoker. For a smoker, they don't want to know. And for others who could be affected with lung cancer, they too don't want to know, because some of them have got they don't want to have a financial burden. They do not know how much they can, they many has taken it for a long time as a death sentence, so they do not know how much cost they will have to incur as they progress along. So they just don't want to know. And I think that there's a lot that all the policy makers and stakeholders have to do, is to continue with education, and have and to amplify awareness, of the fact that not only just smokers get cancer, but anybody can get. Now, how successful we are, I'm now involved in one exercise to try to get volunteers to contribute towards the study as how large a percentage of the population could possibly get cancer or lung cancer. But the responses have been very, very big, right? Because it's not easy to get people to come up with it, because some of them just don't want to be a burden to the family, right? Be financial or otherwise. So removing stigma is still a long course, and you need a lot of education, and also the willingness of the would-be patient, to come up and say that, I want to look at my health and see what it is. As I said, in the case of Singapore, very good medical healthcare. Everybody is complacent to the fact that, I will be looked after, so I don't have to worry so much.
Thanks, Francis. No, I think that's really important. Again, knowing or hearing about this from, again, the patient's perspective, and that angle, certainly us as physicians, we don't normally necessarily understand or necessarily see. So I think it's great to have all the stakeholders involved, and for us as well. I mean, stigma is very important, because we know that if we're able to combat and reduce the stigma, there will be a lot of interest and buy-in from not only the patients or the families, but even the community as a whole. And I think this is where I would like to then pivot my question to Judy, because you've been working with our Thai colleagues through the establishment of these roundtable discussions, and you were then also able to engage the public policy administrators of Thailand. And maybe if I could just get your views on how things worked out in terms of, were they receptive, for example, of these discussions, and what were some of the main learning points where your discussion in Thailand can potentially help us in other regions within the Asia Pacific region to talk to our governments as well as their ministries of health, for example?
Thank you, Herbert, and thank you, everyone. I think the experience that we had with working with the Thai government and policymakers were quite interesting in our learning as well, because as you all know, Aspire is still in our we're only in our second year of conception. So the Thailand roundtables and also a couple of other roundtables within the region are sort of the first local initiatives that we have been rolling out. I think a couple of experience that we had with Thailand and success factors that I think is helpful in consideration for future roundtables, as well as for I think all of us that have been partnering together, is the involvement of a multilateral group and different stakeholders in driving these policy discussions and policy changes. So as I mentioned earlier in the presentation, our roundtables are designed or hosted in a way with a lot of different stakeholders involvement. So not only ourselves, but also local clinicians and policymakers, as well as different patient groups as well. So it's sort of different people coming together with the same goal and different voices, but actually talking about the same topics and also similar interest. And that really drives the dialogue. And also, I think that really gets the I guess the multifactorial discussion going for a lot of the policymakers. I think it's helpful for them to see it from different angles, so that they understand these different issues. Not only from the clinicians, but also equally as important from the patients and people who are living the journey and the experience themselves. So also, I think continued collaboration with the different government stakeholders and actually getting them involved was helpful. So, giving them a space to talk about what is sort of the government's bottleneck, because, for the governments to not pursue something or not be able to roll out certain things at this point of time, there is, it's not like a lack of willingness, but sometimes there is, different perspectives to it, like lack of resources. There's always, resources are never unlimited, and so they need to understand what's the cost effectiveness, and also what is the benefit of rolling out something. And so we found that these kind of conversations were extremely helpful in having a bidirectional conversation with the policymakers. So they shared what was their bottleneck, and the patients and the clinicians, and also Aspire team, we shared also what were the priorities and what were the objectives for us, so that we could understand each other and come to sort of a consensus, or just come to a set of recommendations which were realistic and also helpful for the government at the same time. So yeah.
No, that's great. And I think certainly,
Thanks.
the work that you and Will and others have been doing with Aspire, given the fact that you've been involved in the various countries, you're able to be the bridge between the different countries and bring that knowledge and help them share. For example, you could go to Thailand and say, well, we've already had this roundtable in Hong Kong, and these were some of the discussions that they've had. And, having your organization, throughout the Asia Pacific region really helps, again, all of us upscale our efforts in this particular field. So thank you. I think before we end, I do want to hear about our global perspectives as well. And, Helena, with the Lung Cancer Policy Network, you've really been advocating for lung cancer policy changes around the world. We've talked a lot about the Asia Pacific region. It'll be great for us to learn a bit more about what's been going on around the world and what we can learn from a global perspective and bring it to our own countries here in the region.
Thank you, Herbert. Hopefully I can offer a few kind of thoughts to provide some food for thought for kind of next steps in the region. I think the focus on earlier detection is where the policy conversations remain, and there's definitely a sense from the communities that we work with, so clinicians, researchers, and patient representatives critically, that earlier detection offers the best kind of opportunity to change that long-term picture. I think where the conversation is continuing to shift, particularly with our work as we evolve, and the global conversation evolves, not just with a focus on the US and Europe as it maybe has in sort of the last decades, that the point of this webinar and these partnerships is to ensure that the work that the network does, but also the policy conversation, is globally representative. So therefore, with that in mind, the sort of resource stratified approaches. So being very, very mindful and thinking creatively and realistically about what different locations should be implementing in the sort of short, medium and long term. So just to give an example of the kind of aspiration or drive towards earlier detection, as we've talked about today, low-dose CT screening may not be immediately feasible in some locations. So how can we still move towards earlier detection using X-ray plus AI, but with a longer term view of having low-dose CT screening programs as the gold standard? I think also from a global perspective, the eligibility conversation for earlier detection and screening specifically continues. The evidence continues to become much stronger, and thinking about what is going to work best in different locations around the world. And I think sharing that evidence from a range of different perspectives and locations is going to be really important. But just one final thing is that I think, as I've just done, and these conversations often do, we do talk a lot about earlier detection, but it's really important to remember that as we aspire and strive towards implementing earlier detection programs, such as screening, that there are still, whilst that they're getting underway, there are still people who are being diagnosed with lung cancer at a later stage. And it's really critical that those people are receiving the best available treatments and access to care, and that doesn't change, and that we continue striving to deliver the best for those people, whilst our earlier detection efforts are hopefully changing the longer term picture for lung cancer.
Thanks, Helena. And I think it's good to know that, there are different efforts that's going on around the world. I think what we're doing in the Asia Pacific region certainly is in line with some of these efforts, and there's a lot of learning opportunities. And again, thanks to LCPN for really coordinating all this throughout the world, where we're able to interact through you with our partners and colleagues in other countries, and likewise for them to interact with us. So time really flies. We're now at the top of the hour already, and certainly, if there are any questions from our attendees who are unable to type in the question during today's webinar, to begin with, I believe, of course, our webinar is actually recorded, and certainly you'll have a chance to review some of the discussions that we've had on the recording. And hopefully, if you do have some interesting questions which you might want to direct to any of our panelists, do feel free to contact us. So these are the contact details of both APCLC, Aspire, as well as the Lung Cancer Policy Network. And certainly do email us or find a way to get in contact either through social media, including, say, X or LinkedIn. And I think all of us here who have been on the panel will be very happy to have further discussions. With this, I would like to thank again all my panelists for joining us on this Monday afternoon, Asia Pacific time, and certainly really early in the morning in the UK, as well as around slightly after lunch in India. So again, thank you for taking that 1 hour out of your busy schedule to join us, and hopefully we'll be able to have more discussions as well as more meetings like this, where we're able to share some of the collaborative efforts of, say, lung cancer policy advocacy within the region, and hopefully we'll be able to give you our participants and our attendees some particular pointers as well as some particular suggestions on how you can engage your lung cancer policy makers to really try to improve lung cancer health within our region. So with this, thank you very much again, and hope to see you all soon, and look forward to our future conversations. Thank you very much.